we all have to deal with stress every day. The key is figuring out how to handle it. And the answer is, of course, easier said than done. So in honor of Stress Awareness Month, Dr. Sarah Getch from Kansas City University joins us. Good morning to you.
Good morning. How are you?
I am well, thanks. Okay, so a lot of us try to brush off stress, move past whatever it is. But what is the risk of not confronting our stress?
Well, the risk of not confronting stress is never learning how to actively cope with it. So while avoidance might be a short-term solution and it might feel good in the moment, as far as a long-term solution, avoidance just isn't going to work.
Stress can actually make us physically sick, right?
Yes, so stress can affect us emotionally, physically, and behaviorally. So physically, I think, is one of the first symptoms where people really start to feel stress. Some of us feel it in muscle tension. For me, it's right between my shoulder blades, on my back. Some of us get headaches, upset stomachs. So physically, it's taking a toll. Also, in the brain, we know that stress can cause neuron cell death. So that's problematic, right? Long-term chronic stress. And then as far as our mood, we can feel anxious. We can feel overwhelmed. Some of us get really irritable when we're full of stress. So that's something to think about. And then behaviorally, some of us are stress eaters. So we might increase the amount of food that we're eating in order to cope or decrease the amount of food. We also might just engage in lots of different bad coping mechanisms when we get involved with a high stress situation. And those are things like substance abuse or drinking, alcohol, all of those things that might affect us negatively because we're encountering a great deal of stress.
So can stress ever be a good thing?
Yeah, I mean, I guess in small doses, stress can be a good thing. So stress could be really motivating because it sometimes makes you feel a little bit anxious. It's that little kick that you needed to get something done. So it could be helpful there. Another way that it could be helpful is that sometimes it really helps people build relationships. I know that sounds strange, but if you think about it, when you're feeling overwhelmed, you're more likely to turn to the social supports that you have and say, I'm feeling really overwhelmed. Do you think you could help me? And that vulnerability that you show in that moment can really help to form better relationships with the people around you. But really, why a little bit of stress can be a good thing is because it builds resilience. We as humans, we're meant to do hard things. And so learning how to overcome a challenge like a stressful event can be really good for us.
How do we know when it crosses that line, though, and becomes unhealthy?
I think if you're experiencing some chronic stress and you're seeing the symptoms that I mentioned, and then you're trying some coping mechanisms that we're going to talk about here in a minute, but you're not seeing any relief, I think that's probably the time to call your doctor. And then, anytime you have really severe muscle strain or if you have chest pain, something like shortness of breath, things like that, that's probably something a bit more serious and it's time to call the doctor.
Okay, let's get to the stress cycle. Tell us about that.
Okay, so doctors Emily and Amelia Nagoski, they recently wrote a book about burnout and stress. And so they speak about the stress cycle here. And these are different ways that we can cope with stress. So if you are feeling very overwhelmed, let's look at some of these things that we can do. So physical activity. And I want to mention, it's really important when we're dealing with stress, it's always better to actively cope rather than to passively cope. So activity can mean lots of different things. It can mean physical activity. Physical activity is good for you. Moderate activity between 20 and 60 minutes a day is really going to improve your stress levels. Also breathing. So breathing is very important, not just the breathing that we do every single day, but some nice deep breaths. We would call them diaphragmatic breaths coming from your diaphragm. So some deep breathing and being centered and in the moment can be really helpful. And then relying on your social supports, your friends and family that bring you comfort and joy. Reaching out to those individuals can also be a good way to reduce stress.
Awesome. Thank you so much, Dr. Getch. We appreciate your time this morning.
Sure. Thank you so much for having me.
Have a great day.
You too.